An ACL reconstruction, I would say, is neither a major nor a minor surgery. It's somewhere in between. But honestly, if you've never had surgery before, this is going to be pretty major for you. And we've always got to try and think about things from the patient's perspective. When you're choosing a surgeon for an ACL reconstruction, you want not only a surgeon where you've got good communication with them, where they've got some years of experience behind them, but also a surgeon that has a well-developed practice. So they're doing this day in, day out. They have a good network of physiotherapists that they work with regularly. They have a reliable technique, and they understand their own results. ACL reconstruction is one option. The other, of course, is non-operative treatment. And physiotherapy on its own can bring some stability to the knee. And if it does bring adequate stability, it may be that that is sufficient for you. But if you're putting significant stresses, rotational stresses on the knee through sports or other vigorous activity, you may find that the knee it remains unstable. And if that's the case, that's when we really should be looking at a reconstruction. So your options are always going to be non-operative and operative. Non-operative care includes physiotherapy alone. Operative care is a combination of physiotherapy and surgery. And surgery really brings two major benefits to it. First of all, it's the additional stability. And if you tried non-operative care and the knee remains unstable, then the ACL reconstruction can hopefully bring that stability. If we don't bring that stability, what can happen is when the knee goes through what we call a pivot shift, it twists. It can cause damage to other structures in the knee, such as the meniscus or the cartilage. Now, the other benefit of the ACL reconstruction is that feeling of stability that it can bring. So if your knee feels unstable, you can lose confidence, reduce your activity level, and you can find the world sort of shrinks. Your world shrinks around you a little bit, and you can end up doing less and less to protect your knee. So it's really those two main things, is one, perceived stability, and two, actual stability. To get your maximum recovery after an ACL reconstruction, you're actually looking at 18 months. But don't despair. Usually by 9 months, you can get back to most twisting sports. And usually, in fact, by the 3-month mark, actually the knee's feeling fairly stable, reliable, and hopefully better than it did beforehand. But we do, when we look at the National Ligament Registry, we can observe improvements in the first 6 months, 6 to 9 months after surgery. But then there are further benefits that go beyond that as well.